Stains used for amyloid. The first one is stain on gross. This is the oldest method used. Lugol's iodine imparts mahogany brown color to amyloid containing area. On addition of dilute sulfuric acid, it turns blue. This starch-like property of amyloid is due to the AP component, glycoprotein. The second one is hematoxylin and eosin stains. Hematoxylin and eosin stains appears as extracellular, homogeneous, structureless and eosinophilic hyaline material in relation to the blood vessels. If the deposits are small, they are difficult to detect by routine hematoxylin and eosin stains. A few other hyaline deposits appear pink. The third one is Congo red and polarized light. This method is used for confirmation of all amyloid types. Since all the types of amyloid have affinity for Congo red stain, the stain may be used on gross and microscopic sections. It stains pink-red color. If the stained section is viewed in polarized light, it appears apple green birefringence due to cross beta plated sheet configuration of amyloid fibrils. The stain is used to distinguish between AL and AA amyloid. Treatment with permanganate or trypsin on the section in case of primary amyloid, that is AL, Congo red positivity persists. For secondary amyloid, the Congo red turns negative. The Congo red dye can be used as an in vivo test. The fourth one is fluorescent stains. Thioflavin T binds to amyloid and fluoresces yellow under ultraviolet light. That is, amyloid emits secondary fluorescence. Thioflavin S is less specific. The fifth one is Rosaniline dyes, metachromatic stains. The dye reacts with amyloid and undergoes a color change. Methyl violet and crystal violet imparts rose-pink coloration to amyloid deposits. This method, however, has low sensitivity and lacks specificity. The sixth one is immunohistochemistry. Here, corresponding antibody stain is used against specific amyloid protein acting as antigen. The most useful stain is anti-AP stain since the P component is present in all forms of amyloid. To determine biochemical type of amyloid, anti-AA, anti-lambda, anti-kappa, and trans-thyretin stains can be used.